Raj, we can start.
Okay, hello everyone. It's nice to see you again. My name is Raj Mehta. I'm a family physician, and today I'm going to be going over the second part of my talk on hypertension, and this talk will be focused on hypertension treatments. Now, I want to begin by highlighting that everything I discussed today comes from guidelines published by the American Heart Association and the American College of Cardiology here in the US, and these were recently published at the end of 2025. So these are the most up-to-date evidence-based recommendations we have. And to give you an idea of how these major US organizations make these recommendations, they look at the evidence. They look at lots of clinical trial data. So these are studies involving people, where we do a very good and safe job studying them. And all of these studies are, of course, reviewed by government agencies like the FDA and things like that to ensure they're high quality for, let's say, medication approval, things like that. So it's a very high bar, very high threshold before physicians or any guidelines or the American Heart Association is going to say this is something we recommend, they want to be very sure that the evidence is very strong, very robust. Sometimes they don't know. Sometimes they'll say we don't have enough evidence. We can't really say yes or no. But it's really helpful to understand where the evidence is coming from as I talk about these things. And again, if you have any questions as I'm going through this talk, please stop. Please interrupt me if I'm going too fast. Slow me down. I'm always happy to take questions and have a discussion. So first, I went over this yesterday, but one of the big things of blood pressure treatment is that there's not one treatment target or goal for every patient. We try to individualize it and we try and say, if you're higher risk or if you're lower risk, we have kind of different approaches. And the idea here is that someone who's a sicker person who's higher risk, maybe they have diabetes, maybe they have kidney disease, maybe they have heart problems, we are going to be a little bit more aggressive in trying to get their blood pressure lower because they're high risk. There's a higher chance that something bad could happen. On the other hand, if someone is lower risk, we might not be as strict. We might allow and tolerate a little bit higher blood pressure. We may not be as aggressive. Okay. So those are things to keep in mind is that we don't target and make recommendations the same for every patient. We take into account who they are as an individual, how they might be treated as an individual, and do we think they're higher risk or lower risk, and how we're going to try and manage them accordingly. So one thing I'll say is that another big thing with higher risk patients is that if they have uh, are high risk, we try and get their blood pressure really below 130/80. Now, lower risk patients are those patients who don't really have other comorbidities or other health problems. So these are patients without diabetes, without heart problems, without kidney problems, and hopefully their cholesterol is normal and they're otherwise healthy, right? Um, in these people, we're trying to aim more for a blood pressure below 140/90, and we really want to strongly emphasize non-pharmacological, meaning non-medication options. So what are natural ways we can lower blood pressure? Because we want to try to say, if we can, let's lower your blood pressure through natural methods and only really talk about medications if it's absolutely necessary, right? We want to be conservative and safety first. Good. So one of the things that the American Heart Association acknowledges, and something I've seen a lot in my own practice, is that there is a gap. And the gap is that although we have goals for where we want people's blood pressure to be, and we want to try and encourage people to do things to lower the blood pressure, um, many Americans, up to 44%, only 44% actually get their blood pressure at goal. So more than half of Americans, their blood pressure is higher than where we want it to be. So a really important fact. So most of us, we're not really getting our blood pressure where it's ideal. The second thing here is that lowering blood pressure does actually make a big difference. And on average, every 10 points you can lower your blood pressure when it's high reduces your risk of having a heart attack or stroke or some kind of bad event by 20-30% over your life. So it's a substantial improvement if we can get the blood pressure lower. And then, of course, how we lower it is an important discussion people need to have with their physician. But I really want to emphasize, I'm going to go through things that everyone can do at home um, that can really make a big difference here. So the foundations of managing blood pressure well are these non-pharmacological interventions. And I really want to try and go some detail here to kind of explain the reasoning and the process behind these. And again, please jump in with questions as you have them. So number one is diet. There's a saying, you are what you eat. And there's no question that eating healthy is a key to living a healthy life. And this is never more true than in blood pressure. And we know that people who have healthier diets, their blood pressure is going to be lower. And people who have unhealthy diets, their blood pressure is higher. And there's a lot of excellent clinical data to support this. This isn't just us thinking it. We've studied patients, we've done clinical trials, we can see this makes a difference. So first and foremost, the big diet that we've studied is something called the DASH diet. And this is a type of diet where we try to have more fruits, more vegetable, more whole grains, and less fat and less dairy. Okay, so again, high fruits, high vegetables, high grain. And you're reducing the fat. You're reducing saturated fats, total fats, and fats from dairy, from milk-like products. And when you make these switches in your diet, on average, we find that you can lower your blood pressure by 5 to 8 points. Okay. Now, I'm going to talk about salt in a second, but because that's a very important different topic. But this is a dietary change that I'm not even discussing salts. I'm just saying we change the way we eat and we focus on fruits, vegetables, whole grains, less cholesterol, less fats, less dairy. Any questions about this at all? I can say personally, I find this really interesting data. And I also find it very interesting that it aligns with my concepts of ahimsa, because I think there are many people who believe in nonviolence. And so that means oftentimes having a more plant-based diet. And certainly more fruits, more vegetables, avoiding meats and fats, taking that approach to your diet, I think is a very ethical approach, but it's really great that there's clear evidence and that even the American Heart Association recommends following that kind of dietary pattern because it can make such a big difference in improving our health and lowering our blood pressure. Okay, next, I'm going to talk about salt. So everybody knows salt can cause high blood pressure. And of course, lowering salt can lower your blood pressure. So how much should we lower our salt intake and what should be our goal? So on the leftmost, I have here, for most people, we say less than 2 grams a day or 2000 milligrams. So that's kind of like the goal I set for most of my patients. If you can get to 1500, which is very hard, you can really lower your blood pressure even more. But wherever you're starting, let's say most people don't actually count how much salt they have in their diet, and it can be quite a lot. I actually read one study that was looking at salt intake in Indian diet among people who live in India, and it said some people ate somewhere 6 to 9 grams a day, which is just so much salt. So if you're someone who's eating 4, 5, 6 grams a day of salt, that is way higher than the recommendation of 2 grams a day. And every 1 gram you can decrease will lower your blood pressure by 5 to 7 points. So if you take someone who's eating, let's say, 5 grams of salt a day, and you can cut them down to 2 grams, so lower them from 5 to 2, that 3 grams a day reduction in salt can lower their blood pressure by 15 points or even more. So it can make quite a big difference if you're on a very high salt diet. Now, for many people, as I mentioned, trying to get to 2 grams of salt a day or less than 2 grams is very difficult because salt is an important condiment that adds a lot of flavor for a lot of different food items. So one clever approach is to use salt substitutes. And a salt substitute is that rather than just doing 100% salt, what you do is that you mix the salt with potassium. So you have it where 25% is potassium chloride, so about a quarter, and then 3/4 is sodium chloride. And so rather than having pure salt, you have this mix with a little bit of potassium with the sodium in it. And the salt substitute where you mix it is actually very effective. It can lower your blood pressure. So for those individuals that have a difficulty of just giving up salt, if you just replace your traditional table salt shaker with a salt substitute, which mixes in and has 25, 30% potassium, that alone can lower your blood pressure by 5 to 7 points and make a big difference in improving your health. Now, for anyone who has kidney problems, you have to be a little bit careful with potassium. So there's a caveat there. But for vast majority of people, this can make a huge difference. And I have a lot of success with patients. When I tell patients try not to have more than 2 grams of salt a day, that's very hard. When I just say, listen, if you're going to use salt, just use the potassium amount, mixed salt, much more successful and a lot of good evidence that not only does that lower blood pressure, but that can reduce your risk of heart attacks and strokes and things like that.
Dr. Raj, are these substitutes easily available, like potassium?
Yes, yes, you have to look for them, but they are easily available. You can go online to Amazon.com or to GNC or a lot of places, and what you look for is salt substitute or potassium substitute, and there's different variations, and you can read like some that are 50-50, 25-75. Now, I will say that one of the challenges is that they do taste a little bit different. So if you do like a 50-50 and there's a lot of potassium salt in there, that might taste off to you. I think when you do the 25-30%, it's more balanced. So, but yeah, these can be available everywhere. Pharmacies, we usually will have them, but you may have to ask where they keep them because it's not obvious. If you go to a grocery store, it might be a little bit trickier, but you can ask, and most of them will have some sort of salt substitute available.
What about bananas when we eat bananas with our meal?
Um, Excellent. It's like I planted you. So one thing, you're absolutely right, that can improve our blood pressure, regardless of how much salt we have, is more potassium. So the more potassium we eat, it can actually lower our blood pressure. So encouraging people to eat bananas, having more potassium in their diet can make a huge difference in lowering blood pressure. And so this is a curve here that shows that if we have more potassium, we can definitely lower our blood pressure. Now we have to be careful because too much of anything can be bad. So yes, having more potassium in our diet will lower blood pressure, but if I do too much potassium, that can paradoxically cause this curve to go up and increase our blood pressure again. So if you're having 1 or 2 bananas, that's great, but don't go and eat 12 bananas a day because that's not good for you either. So balance. But yes, just as too much salt can be bad, if we don't have enough potassium, that's bad. So less salt, more potassium in our diet on balance will help our blood pressure out.
Do you know about the pink salt, Raj?
Yes. So pink salt is a formulation of this salt substitute. So you have to be careful. There are some pink salts where it's still 100% sodium because they call it a pink salt. But the perfect pink salt is the ones that are the salt substitutes. There's a pink salt which has some potassium in it. And you can't just say read pink salt label and know for sure which type it is because they'll market it that way, but you actually have to read the label. So if you read the label of a type of a pink salt that does have some of this potassium in it and it's mixed, that's excellent. That's exactly what we should be aiming for.
Black salt?
Black salt, I'm not as familiar with having the potassium in it. I know it's marketed. Since you've asked me this, I'm going to double check and look it up real quick. But I don't think black salt has it as much. But again, if you're ever unsure, just read the actual ingredients. Yeah, I'm looking at this. So black salt, it does have a different flavor to it and a different color, but it doesn't guarantee that it has potassium in it. It tends to have more sulfur in it. And so again, just read what the what's actually in it, and that way you'll know for sure. The challenge with a lot of these things is that because they're condiments, you can write whatever label you want on the top and then put whatever ingredients you want inside of it. So regardless of what the label is written, read read what's inside of it, and then you'll know whether it's what you're looking for. Any other questions here?
Dr. Raj, I'm just reading, the contents of this pink salt, which I have at my home. I'm just trying to see, where do I see? I see sodium like 420 mg, 17%
If
DV.
you have your camera on, you can put it up and we can take a look together.
Yeah, sure. I don't know whether you can see or not. Let me see. So that's the one I have. I don't know whether. Let me remove the blurry, here so you can see a little more clear.
Yeah, I see that. Okay. So yeah, so in that ingredients section, it should probably say if there's any potassium chloride in it. And I'm
I
not,
don't see.
yeah, I don't see that either. So that's probably one where they call it a pink salt, but because they don't have the potassium in it, it's not actually the salt substitute that I'm advising for.
Right.
And
Okay.
that's a good example of how tricky this is because you can read it and be like, oh, it's the pink salt, but you have to read what's inside, and then you'll know.
Sure. Thank you.
Yeah, my pleasure. Anyone else? Okay.
One more question. So,
Yes, ma'am.
for example, this pink salt, it doesn't have potassium. So, is it good to have, or it's better to have the normal salt?
That's a good question. So the point I'm making here is that if you have normal blood pressure, and then it's fine, you can whatever you want. But if you want to be healthier, having a potassium salt substitute is better. When marketers sell things, they can call it pink or black, whatever color they want. There's no
Mm-hmm.
guarantee that has a specific ingredient. So you just have to look at the label. If it has potassium, 25, 30, 50% mix, that's great. That's going to be way better for you than just traditional salt. The best thing is nothing. So no salt, but that's not practical. And rather than having pure salt, if you're going to use something, use the salt substitute. That's why I say salt substitute, right? I'm not giving it a specific title like pink or yellow or blue.
Mm-hmm.
Salt substitute, read the ingredients, make sure it's 25 to 30% potassium chloride is in there. Okay, you need to look at that and see the words potassium in it. And again, if you go on if maybe I should go out and put a picture from Amazon, but if you go on Amazon, you can look for salt substitute, look for potassium chloride, and you will find it.
How about, it says a lot of minerals, it has like 84 minerals. How does that help?
Doesn't matter. Minerals
All
don't
right.
matter. It's just about as long as there's potassium and salt in a mix in it.
Sure.
All right, I'm going to move on. Okay, so the next big thing I've talked about diet, potassium, chloride, salt, chloride, is weight. So unfortunately, being heavier, being obese, more body weight does increase your risk of blood pressure. And trying to lose weight is a great way to lower blood pressure. And for every kilogram you lose in weight, you can drop your blood pressure about 1 point. So someone can lose 10 kilograms, they can lower their blood pressure by 10 points. So really, really important. The keys to losing weight are eating healthy and exercise. Nowadays, there are medications like Ozempic and other GLP medications that can help certain patients. And for very obese people, bariatric surgery is always an option. But of course, we really prefer to recommend exercise, healthier diet, and trying to achieve weight loss using those methods. Reducing alcohol intake. So this is also an important one. The less alcohol people drink, lower the blood pressure. Exercise. So exercise is hugely important for lowering blood pressure. So the recommendation is a combination of aerobic and resistance. So aerobic exercise means something where you're jogging, you're riding a bicycle, it's improving your cardiovascular health. It's different from weight training. Weight training is anaerobic. So weight training can be helpful for certain things like in diabetes, but for cardiovascular health and for blood pressure, we want aerobic exercise, running, jogging, swimming, those kinds of things. It's recommended to have 90 to 150 minutes a week. And if you're doing this, it can definitely lower your blood pressure 4 to 8 points and even more. Now, it's really important that when we say exercise, exercise usually means your heart rate is above 120. Okay, walking is an activity, it's not really an exercise. So if you're walking, that's still actually very helpful. That's better than sitting on the sofa. So walking is great and it will help to lower your blood pressure. But if you really want to be doing exercise, it has to be something which is more activity that causes your heart rate to go up. Okay? And for those people who like weight training, dynamic resistance, which is a form of weight training, can also be helpful in lowering blood pressure. So that's also something you can do, and you can do a combination of both aerobic exercises and things of dynamic resistance to really help bring blood pressure down. I'm going to skip that. Okay. So one of the wonderful things that can really, really help lower your blood pressure is lowering stress in our life. And there's an understanding in medicine that there is a connection between the mind and the body. And I've always believed this, but it was really incredible to see that in our American Heart Association guidelines, they actually have very strong evidence recommending to do this based on really good, well-done clinical studies. So they mentioned two different approaches. One is meditation and one is breathing control. And so in the guidelines, they actually walk through this and they say meditation can be very effective at lowering blood pressure. And they, based on the data they've seen, they recommend at least twice a day of 20-minute sessions, and that this can lower your blood pressure by 5 to 7 points. And in addition to that, if you're also doing breathing control exercises, this is something where you can do 15 minutes daily and you're trying to slow down your breathing to about 10 breaths a minute as a goal. That can also lower your blood pressure by 4 to 5 minutes. So both meditation and breathing control can be very effective. And I really like that they have that minimum there. At least try doing 20 minutes twice a day. Try doing breathing at least 15 times a day. Both those things can be really effective at bringing your blood pressure down. Questions there? There are other things that they looked at, but they weren't able to give as strong a recommendation because the evidence is not there. So they're trying to be very evidence-based. So they looked at acupuncture. There were some studies, but not enough to really say for sure that they can be confident they can lower blood pressure. They tried looking at other meditation techniques, and so they weren't exactly sure about it. Some people talked about biofeedback, Tai Chi, and then Ayurvedic type medicines. All these things, I think some people have beliefs in them and they may be effective, but it's not something I can tell you for sure it's going to be helpful. I just don't have enough evidence to say the same way I can say for meditation and breathing exercises. Okay. When we've done studies asking people what kind of things they're interested in, eating healthy is very effective. Aerobic exercises, resistance, sodium, potassium changes, lifestyle interventions, breathing, meditation, all those things can work together. And when you add them all up, you can get a really high strength effectiveness in lifestyle changes to reduce your blood pressure. Good. So next, I'm going to briefly talk through medication options. But before I jump to that, does anyone have any questions on the non-pharmacological part that we've just kind of gone through?
What is the biofeedback that was in the chart?
So biofeedback it was not particularly effective. It's a strategy where they're trying to give people feedback as they do certain things, like if you eat certain foods, you do certain behaviors, you try to change habits using these kinds of methods. And
Oh,
so, we all believe that, like, I'm a parent, so I have children. So I like to think when I tell my children, do your homework, do this, do that, I'm nudging them the right way, and I'm trying to set good habits to do that. Um, but when I'm dealing with adult patients and we're trying to do those kinds of the same things to get them to change habits related to blood pressure, it's not quite as effective, right? And I think with adults, it has to be more internal motivation that drives these things. It's harder to externally push people to do it. So does that kind of answer your question?
yes, thank you.
Yeah. Okay, so I'm a physician, so before I do this, there's a lot of details I can go in with medications and classes, and I don't want you guys to get overwhelmed. I'll be using a lot of things here, but I just want to give you a general sense of how this works and how I think through this. So the first thing is that when we have to start medications in patients, we only really go to this step if lifestyle changes haven't worked. So a lot of my patients, I'll really try. I'll say, change your diet, exercise, eat healthy, try and lose weight, try to give 3 months, give 6 months, give people an opportunity to really lower their blood pressure. A lot of times they can succeed. For some people, they just can't do it, or their blood pressure is just so high it's not safe for me to just let it continue being that high. I want them to do the healthy lifestyle things, but it's really high and I need to give them some medicines just to be safe and get it down. Okay. There are a lot of medicines out there, but we know based on guidelines that there are basically 3 types of medicines that are very safe and very effective. And so those are our first line agents. And those are the most common medicines we use for treating high blood pressure. And those 3 types of medicines, typically known as calcium channel blockers, thiazide diuretics, and ACE inhibitors or ARBs. They kind of run together. And so those are the ones that I'm kind of outlining here, and they're all can be very, very effective at lowering blood pressure. Calcium channel blockers are probably the most commonly prescribed, but they're all very, very common. And any of them are excellent first-line choices for when I have to begin managing a patient and consider blood pressure medicines. Now, each medicine is different. They have pros and cons, different side effects. So depending on the patient and the person and their goals and other health concerns, we may pick one medicine over the other based on those factors. So thiazide type diuretic. So these medicines are medicines that are basically water pills. They lower your blood pressure by helping your kidney excrete more sodium, more fluid. So they make you go to the bathroom, but they're quite effective at lowering your blood pressure. They're easy meds to take because they're once a day, um, and a very, very popular type of drug. Now you have to be careful because with any water pill, sometimes you can get dehydrated. So those are the main things we look out for. But an excellent medicine and one of the first things we usually start with when treating blood pressure. Another great class of medication are those known as ACE inhibitors and angiotensin receptor blockers or ARBs. These are medicines that can lower blood pressure. They can protect the kidney. They can protect the heart. So very, very excellent medicine, especially in those that are low risk. And then finally, calcium channel blockers, CCB. These are medicines which are very effective at lowering blood pressure. They're nice in the sense that they don't have side effects like the water pill does. They won't make you go to the bathroom. But at very high doses, some people can get some leg swelling from them. So we just have to be a little bit careful with that. So those are the 3 first-line major medications. Now, after those 3 medicines, if people are still having high blood pressure, we might consider other medications. One group is called beta blockers. Usually, I don't use this unless someone has heart problems, heart disease, heart failure, because it can be effective there, but they can also lower blood pressure. Um, then there are a couple others, MRAs, loop diuretics, and so on. There are dozens of medicines for blood pressure. So I'm not trying to give you a medical in-depth lecture like I would to another physician, but just be aware that after those first-line agents, there are other meds out there that are available. A lot of times in most patients, if I'm going to be starting medications, I usually only want to start one pill at a time, one medicine at a time. But some people that have very high blood pressure, I might start 2 medications. Okay? There's also been a shift in practice the last kind of couple of years. In the old days when I'd practice, if someone had high blood pressure, I might start them on a low dose of one medicine. And if the blood pressure is still high, I might still increase the dose. But nowadays, combo pills are becoming very popular. And the idea of a combo pill is you have one pill, but it'll have 2 drugs in it. And a lot of times what they'll try and do is that they'll put lower doses each of those 2 drugs. So they'll say, rather than taking a high dose of one drug with all its risks and side effects, why don't we take low dose of 2 different drugs, and we can still get good blood pressure control, but maybe not as many side effects. So combo pills are becoming more and more popular now. And I think that is the end of my talk. These are my main references. Questions?
Dr. Raj, going back to the sodium management.
Yes. Let's go back. Okay.
A general question is sometimes we do weekly fasting, like no sodium, once a week, 1 day per week. Is that effective or?
That's a great question. And it depends. So the body is very interesting, and the body carries extra stores of most vitamins and most substances that are important. And it kind of has different cycles. So salt is an interesting one because sodium cycles, I think are the best data I've seen is they almost work on monthly type cycles. So the idea is that it's a day-to-day change in your sodium has to take a month before it makes a difference in your body. And so if you're fasting every other day, you have a day where you eat and a day you don't eat. The question isn't so much about what you're doing when you're fasting. The question is that how much salt do you eat when you're eating? And so if you go a month and you're fasting every other day, but the days you're eating 6 grams of salt, that means on average you're eating 3 grams of salt a day. So over the course of the month, you're still getting too much salt, right? So when it comes to this, if you're fasting or you're not eating, even if you do a 5-day fast in a month or every other day, you still have to consider how much salt am I consuming on the days I eat, and then average over the course of the month, how much salt on average am I having daily? And that will really give you a better idea of what your body's sodium balance is like, salt balance, and how that's probably affecting your blood pressure. Right? And the same thing is true if you make this change, if you start lowering your salt intake, and you're like, well, it's been a week and I haven't noticed a difference, it may still be too early. Keep going with it. Sometimes you'll see a little bit of benefit after a week or two, but not till that third or fourth week where you start seeing really consistent changes in your blood pressure.
Okay. Thank you. That's a good point. My other question is not related to this, but a general question about pulse rate. How is the pulse rate related to our blood pressure?
It's a good question, and the answer is we don't really use the pulse rate.
Because when
There's
we
go ahead.
measure our blood pressure with units, home units, it gives a
Yes.
pulse rate, right?
Of course, it gives you your pulse, yes. So generally, blood pressure and pulse rates are kind of treated as two different challenges. So if your heart rate is normal between 60 and 100, we basically don't worry about it affecting your blood pressure. If your pulse rate is too high, we look into that, but we don't really look at that in terms of a blood pressure problem. We try and see is there something wrong with the heart that's causing it. The only time your pulse rate really comes into consideration is when I'm considering what medicines I might use to treat someone. Because if someone's pulse rate is really low, on the low end of normal, I might avoid certain medications that could lower it further. But in general, as long as your pulse rate's in that normal 60 to 100 range, it's not really going to have an effect on your blood pressure. Okay.
Because sorry,
Yeah.
sorry.
After you.
In natural treatments like Ayurveda and all,
Yeah.
those doctors, they measure, the first thing they do is measure pulse, from the wrist.
Yes.
They measure the pulse, and they can diagnose many of the problems just with that. So that's what I was wondering, how
Yeah. So first of all, absolutely. In medical terms, we say heart rate, but your pulse is a very important it's one of the vital signs. So any patient that comes into a doctor's office, we should measure their vitals. And we call it a vital sign because it is vital that we measure it. So, the vital signs are your pulse rate, your blood pressure, your oxygen saturation, how much, how oxygen exchange is happening. And then after that, you can also consider weight as one of it. But right next to what your blood pressure is, every time I see a patient, I want to know what their pulse rate is, what the heart rate is. So it's super important, and it's an essential and vital part of every patient I evaluate and any kind of diagnosis I make. So it is absolutely super important. What I mean to say is that for the purposes of this talk, I'm only focusing on hypertension as a disease. And hypertension as a disease, it's defined as someone who has high blood pressure with a pulse rate. Okay? So if I see someone that has an abnormal pulse rate with high blood pressure, everything I've told you guys goes out the window because they're not a patient with normal hypertension. There's something else going on. I need to evaluate them. I need to diagnose them. I need to figure out what's going on because this is not the average patient, right? When we're talking about high blood pressure, I mean high blood pressure with a normal pulse rate. If your pulse rate's not normal, then we need to start all over from scratch. Okay. So yeah, so it's an essential, important thing to look at 100%. But hopefully it's normal. And if it's normal, then we can say you're normal. We don't need to worry about that and focus on the blood pressure instead. Okay. Does that kind of make sense?
Yep. Thank you.
Yeah, of course.
Also, just from my very little knowledge of this, the when they put the three fingers on your pulse, they're actually not looking at hard, looking at your cuff they're trying to differentiate to three or up. It's like some of the sensation they're feeling rather than the blood pressure.
Yeah.
You know, Ayurveda's looking at your what are three kapha, vata, what's the third one? They're trying to see a balance of those, as opposed to blood pressure.
Vat, Pitta, and Kaph.
Yeah, that's what they're trying to do. And they by sense on
Oh,
the rhythm, they'll decide what you're up or down, and then with rest exam, they can then prescribe something as opposed to blood pressure per se.
I
Yeah.
see.
So
Are are these the Nadi Vaidya we call them in India? Like they measure everything, they put their fingers on your Nadi and then they can tell what kind of problem you have.
yeah.
Heard of Nadi Vaidya, they they can tell what kind of problems you have, by just touching your Nadi.
I've certainly heard of that. I think even in Ayurvedic, the more information, the data you can get from a person's health, the better and more accurate diagnosis can be. So sometimes it seems almost magical. You can just check one thing and know everything that's wrong. But usually, the more you can check and the more you evaluate, the better idea of what you have. And
Right.
anyone who's having health problems, yes, then we should be doing a full evaluation and looking at a lot of things.
So I have a question. Just like how you have high blood pressure, like some people have low blood pressure, is that any flags at all for any health issue?
Yes. Yeah. So I'll say that there's two ways to identify low blood pressure. One is you measure your blood pressure, but a big issue is that sometimes people have a change in blood pressure from when they're sitting and they're standing. So if you're ever worried about low blood pressure, check your blood pressure when you're sitting down and check your blood pressure when you're standing up. And if your blood pressure drops or you feel lightheaded, dizzy, it's super important to have that evaluated. So it's not as common. I maybe have, for every 1,000 patients I have with high blood pressure, I'll maybe have one patient with low blood pressure, but it is something we manage. And uh, interestingly enough, a few of my patients with low blood pressure, I manage them without medications. I just do the opposite of the advice I give you. I make them eat more salt. So I have some patients with low blood pressure. I put them on a salt tablet. They eat tablets of salt a day, and it keeps the blood pressure stable, and they're good to go. And there's various reasons people can have low blood pressure. Sometimes there's other illnesses or diseases. Sometimes as we get older, we get more frail and our blood pressure can get low. And it's something we have to be careful about and watch. And for a lot of people, actually, we can still treat low blood pressure without doing a lot of medicines, just lifestyle stuff. But always important to look out for that. And if you're ever unsure, use your blood pressure cuff, measure your blood pressure when you're standing, and see how it is.
So the pills that you take, once you start them, like, my mother's on two blood pressure medications, um, metoprolol and hydrochlorothiazide.
Yes.
And that is a lifelong thing for her now, right? Probably.
It depends, right? So I have some patients and all they have is high blood pressure, and I can maybe start them on a medicine, but they're able to exercise, lose weight, the blood pressure comes down, and I've taken them off medicines.
I
And so
see.
this is certainly reversible for some people. A lot of my older patients, especially those above the age of 70 and 80, they often have multiple health issues.
Mm.
And for them also, it's harder. I can't tell them exercise. It's harder for them to get them to change their diet, lose their weight. They kind of have certain patterns. And so in those situations, although in theory we could do it, in practice it may be harder and it may actually just be simpler for me to just give them a pill a day rather than tell them no salt in what you eat. Uh,
Mm.
there's also a difference in older people because we try and focus more on quality of life. So sometimes it's a balance. I'll ask my patients, what do you want from life? If you don't want to take a pill and you just want to eat lots of ice cream and have salt in your food, I have to be understanding of that and work with them too. So, if a younger patient who is otherwise healthy wanted to exercise, lose weight, change their diet, I've had many patients like that have taken off medications. older patients or patients with other health issues, there may be other reasons I have them on the medicine. It may be harder.
I think her doctor said because she has underlying inflation because of arthritis, sometimes the blood pressure goes up too.
Yeah, and that's a challenging thing. Yeah.
Yeah. Thank you. Thank you.
If she loses 30 kgs, she'll be 10. Her blood pressure will be down by 10.
Yeah, that's right.
Wow. Yeah, for her age.
Yeah. But
She doesn't eat much. She doesn't eat much. Her diet is like reduced to what she used to eat like 10 years ago, but her belly fat is not going away anywhere. I don't know.
there's that, but and in yesterday's talk when I was talking about the explanations for high blood pressure, the most common cause of high blood pressure is aging. Because as we get
Age.
older, our
Yes.
body's less elastic, the arteries just get stiffer. Like these changes happen in the body that are not reversible, and they cause these things. So we just have to be accepting of that.
But remember, these medicines are lifesavers. These are not medicines you want to trade off unless you're absolutely safe.
Yes, very important that like these medicines, we never want people to be on pills, but these medicines are absolutely life-saving. They help people live longer. They reduce your risk of strokes and heart attacks. Super important, especially my older patients, because I really would hate for anyone to have a stroke, and just be debilitated that way. And so I really do try and encourage good blood pressure control and taking the medicines if they need it. Any other questions? Stop my time here. Thank you, everyone, for your time and your attention.
Thank you.
Thank you.
Thank you, Dr. Raj. Okay, so today, should we start meditation?
Yes, madam.
Anybody is ready to give the session?
I am also ready.
Okay, you can.
So today we do perceptions of breath, and into that one, a dirgha swasa, or we can say a deep rhythmic breathing.
Which is good for blood pressure, by the way. It's a good one to pick.
Yeah, we have just heard that one. So I'll say, let's relax ourselves, right, with this the blood pressure. Taking a deep breath, sit down into this the relaxed posture, and having a Gyan Mudra. We can chant Om for 3 times. Close your eyes slowly. Relax. Exhale first deeply, and inhale with this the deep breath. We can chant Om for 3 times. Deep inhale deeply. And now we are doing a Karyotsarg. Concentrate your mind on each body part, one by one, allowing each part relax by process of auto-suggestions that feel that it has relaxed. We can start with the big toe of our right foot. Allow your mind to spread throughout the toe. suggest to the muscles for relaxations. Relax, relax. Let's we move to this the sole, heel, ankle, and upper part of the foot. Calm, breathe slowly, give a auto suggestions. Relax, relax, relax. Let's move to the calf muscle, knee, thighs, and buttocks, and give us an auto suggestions. Relax, relax. Let our feet completely relaxed and move to this the hip joint and upper part of the body. Concentrations over the front of the lower abdomen. Relax. Given auto suggestions to this relax. Slowly, we are moving from the upper abdomen to the ribs, front and back, the chest muscle, collarbone, up to the neck muscle. Given auto suggestions. Relax, relax. Calm your body, giving an auto suggestions through this relax. Let's move to this the limbs, palm and shoulder. Give them an auto suggestions to the all muscles of our hand to the shoulder. Relax, relax, relax. Now let's move from the neck to the throat, chin, jaw, lips, mouth, cheeks, all our facial muscles, nose, eyes, ears, temple, forehead, and scalp. Relax, relax. Let our eye retina to be relaxed, motionless, slowly and deeply. Relax, relax. Now we are maintaining our breath. Try to watch our breath rhythmically. Taking a more slowly breath and in a deep breath. When we inhale, we full our abdomen, and while exhaling, we empty it very slowly, slowly, slowly. Let's watch our breath coming and exhaling in a rhythmic manner. Slowly inhale, exhale. Slowly inhale,
Suril, you are muted and nobody is listening to you.
Oh, sorry. Oh, slow your breath. Now we concentrate to our nostril, both of those nostril, and watch our breath. Slowly, relaxed way. Maintain a continuity of awareness. Watch your breath. Do not permit yourself to be distracted. Concentrate. Calm. Inhale. Exhale. Very rhythmically. Calm down. Watch your breath. Now try to concentrate on a Gyan Kendra on the top of your forehead and try to see a white light. Calm, slowly, concentrations just to see a white light. Let your breath run rhythmically, slowly, slowly. Inhale, exhale. Inhale, exhale. Now we'll be taking a two very deep breath. We rub our hand and put on our eyes and open our eyes slowly, slowly.
Suril, for taking session. It was good. Just yeah, in between it was muted. So for some time it was interval. Yes. So it was good session. So long and deep breathing is good for blood pressure if it is high or low in both the conditions. And we have already discussed about the breathing exercise, Chandrabhedi Pranayam and Suryabhedi Pranayam. So Chandrabhedi Pranayam is good for controlling the low high blood pressure, and Suryabhedi Pranayam is very good for controlling the low blood pressure. So we are familiar with all these breathing exercise and the meditation also, perception of breathing. And we know that most of the diseases are because of stress. So relaxation is the most beneficial meditative posture or meditation, which can help us to control the high or low blood pressure even. And the lifestyle and eating habits, all these are also very important factors. We have to be careful of them also. When we are continuously working and working, then also it may be and the cause of high blood pressure. But if we can take a rest after 1 hour, that will also help. Or just we can sit in loneliness and just take long and deep breath. That will also make you relaxed. So these are very simple tips in which you don't need much longer time for sitting for meditation or looking for some interval time. Just wherever you are working, you can sit just and take long and deep breath, and your mind and body would be relaxed. So the continuous work also boosts the high blood pressure. So thank you very much.
Thank you, Vanda Miniman.